Okay, next we're going to be talking about the adrenal cortex and aldosterone. Remember, this is not a part of the hypothalamic pituitary axis. And we're going to be talking about the hormone produced, which is aldosterone, which is the main mineral corticoid. And it's produced by the zona glomerulosa, which is on the outer layer of the adrenal gland.
First layer.
Yeah, it's the first layer. Okay, so the stimulus of that is a decrease in extracellular fluid volumes, an increase in angiotensinogen 2 levels, a decrease in sodium, and an increase in potassium. So next we're going to be talking about exactly how aldosterone is made. We're going to go through the renin-angiotensin stimulation of aldosterone production. So whenever there are low levels of sodium and high levels of potassium, the kidneys produce renin. And so renin combines with angiotensinogen, which is produced by the liver. From there, so angiotensinogen is made in the liver, and it goes to the lungs, and it's converted to angiotensin 2 by angiotensin converting enzyme, which is ACE. So that's found in the lungs, and so from there it goes into angiotensin 2. This is a powerful vasoconstrictor, so that then stimulates the adrenal gland, the zona glomerulosa, to produce aldosterone, and it creates it by the DAG-IP3 second messenger. And aldosterone is then transported into albumin. So 50% is transported by albumin, 48% is transported by aldosterone binding globulin, 1 to 2% is unbound. Remember that angiotensin 2 causes synthesis of aldosterone, whereas ACTH causes the cells of zona glomerulosa to grow and function properly. So it was in like the past videos. Okay, so going back to aldosterone. So it has its effects on the kidney at the distal tubule cells, and that's its target. And it wants to basically keep in water and sodium, which will increase blood pressure. Aldosterone also affects the arteries by gene expression. It causes it to vasoconstrict, which increases resistance and increases blood flow, which also increases blood pressure. Okay, so once we have that, so now we'll look at something separate. So an increase in the levels of potassium will cause the cell membrane of the zona glomerulosa to depolarize, making the cell more positive. And so voltage-gated calcium channels will then open, allowing calcium to enter the cell. So more calcium activates the PKC, which is the protein kinase C. So protein kinase C then causes steroid synthesizing enzymes to make aldosterone. Now, how is all of this regulated? It's regulated by any changes in the blood volume, or K levels, and also by A and F, which is atrial natriuretic factor, which stops and inhibits the production of aldosterone, and it causes the excretion of water and sodium, and it also blocks the production of aldosterone. So that's what A and F does. All right, and hopefully this helps.
What about this?
I already did it.
Oh, I didn't know that. You didn't point at it.
Yeah.
Okay. Okay. Good job.